Hello everyone and welcome to AceOSCE's video for today. Thanks for joining me, Alicia. And as you guys know, I try to help people prepare for their PEBC evaluating and OSCE exams. Now, a lot of you are not in Canada, have not worked in a Canadian pharmacy, and don't worry, it was me as well. When I came here to give my exams, I did not know how these things work, which is why I want to give you guys a little bit of a heads up as to expect what is coming up and give you guys a little bit of an eye-opener so you guys know what we're looking at. Today I'm going to be discussing about a really important topic, which is prescription vials. Now, when I give these mock tests to people who are not in Canada, it is a little hard for them to understand what a prescription label looks like, what the vial label says, what are the things that are on there, what are the things they are not. And this is a very important topic because you are going to be product checking these prescriptions once you become a pharmacist in Canada. You may get error questions and error therapy management questions based on prescription labels in your OSCEs. So let's have a quick look at what a label looks like, and hopefully this helps you guys out. So whenever you come to Canada and you get a prescription from a pharmacy, when you get a prescription from a doctor, you take it to the pharmacy and the pharmacist fills it for you. Each medication needs to have a vial label like this. So each medication, even if you have say 10 different medications for old patients, for example, each medication bottle has a different vial label on it. You'll see different elements on this prescription label here. This is just an example. The placement of these elements may be different, such as the patient's name may be lower and the date of the prescription dispensing may be on the top, but all of these elements are required by law to be present on any pharmacy label for a prescription that is given out by a prescription from the doctor. Now, usually it has the patient's name, it has the medication's name, such as here metoprolol, it has the strength of the medication, which is 25 milligrams, it has the dosage form, which is the tablets in this case. It may be capsules, it may be SR tablets, it may be suspension, so anything could be there. You see an RX number, which stands for prescription number. This helps the pharmacies to audit their prescriptions or keep a track record of all the prescriptions that have been dispensed. It's just for record keeping. You have the doctor's name, you have the pharmacy's name, you have the pharmacy's address, you have the pharmacy's phone number so that the patient can reach the pharmacy if they need to. You also have the number of repeats left on the prescription. Here it is skipped 1, and you have the quantity of tablets or capsules being dispensed in that vial. Here it's 60. So this is a really important thing, that all of these things are really important and are needed by law to be present on a prescription label. Sometimes you may get prescriptions to product check in your OSCE stations. Sometimes you may get evaluating exam questions as to, what are the few factors that a pharmacist may need to check on the prescription label, or what does the pharmacist check when they're doing product checking? This is what they check for. On the right side, you may see some little notes such as avoid alcohol beverages, may cause dizziness. These are called auxiliary labels, and these help to tell important points about the medication to the patient. So instead of the pharmacist just speaking it out, these are also on the side of the prescription so that the patient knows that he has to follow these things, such as not to drink alcohol with metronidazole or not have grapefruit juice with certain statins. So these are auxiliary labels. Just a quick question, guys. I did share this with you guys before as well, but keep in mind that all of these things are important to be on a prescription label, but the DIN or the DIN number is optional. It does not have to be there by law. Hopefully this topic really helped you guys out, especially people who are not in Canada and had questions about the prescription labels or were making silly mistakes in such questions. These are really important and easy questions to score marks on. In case you guys have any questions, do definitely get in touch with me. As always, I'm here to help you guys out. I give mock tests for evaluating exams and prepare you guys with practice for OSCE cases as well. So feel free to reach out to me with any of those questions and in case you want to enroll with us. And I'll see you in the next video.